So welcome to the webinar today, which is hosted by Mental Health Australia in association with the Australian Digital Health Agency on My Health Record for community mental health organisations. I would like to acknowledge the traditional custodians of the lands on which we gather, and I pay our respects to elders past, present and emerging. We particularly recognise the ongoing contributions of First Nations peoples to holistic social and emotional approaches to mental health and wellbeing. We also recognise the unique contribution of people with lived experience of mental ill health and those who love and care for them in championing change in Australia's mental health system. Thank you for everyone in attendance today or watching online for joining us to discuss My Health Record in the context of community mental health organisations. The My Health Record represents a really significant opportunity to change how healthcare is delivered in Australia to an approach that is more integrated, coordinated and timely, with greater ownership by people of our healthcare information. Mental health care provided by community organisations is a really important part of our healthcare system, and so it's important that we're all involved in these system changes. I'll now hand over to Ingrid to provide an overview of Mental Health Australia's work to date about My Health Record and with the mental health sector. Thanks, Ingrid.
Thanks so much, Carolyn. So really briefly, as a by way of introduction, we know that My Health Record is a secure online record of individuals' key health information that's available to them and their healthcare providers at any time. There was a national rollout that was opt-out if people didn't want a record created for them in 2018 to 19, so now the majority of the population has one. And fundamentally, it's an opportunity to support more integrated healthcare. So it's more coordinated, more integrated at real time, and where patients have control and access to the full range of their health information. Next slide, thanks, Hannah. So for community mental health organisations, there's some key considerations in thinking about use of My Health Record. One of those is fundamentally the workforce. It's a really diverse workforce across community mental health organisations, but only some professionals can access My Health Record. So to access it, they have to be a registered professional. That can either be clinical or allied health staff that are registered through the Australian Health Practitioner Regulation Agency, or AHPRA, but it also includes staff like social workers and counsellors, psychotherapists who are registered through other approved associations. Other consideration is that often organisations have multiple client information management systems, only some of which can integrate at the moment with My Health Record. Organisations that are delivering GP services or other allied clinical health often already have information management systems that can integrate and are looking at expanding use of those across other services in their organisations. And talking to community mental health organisations, often the benefits that people talk about using My Health Record are around, again, more integrated care, access to health information for clients while they're travelling, supporting multidisciplinary approaches, often in centre-based services. We've got multiple different workforces working together to support clients, and that care coordination function. Some of the challenges that people often talk about are again around having multiple data management systems and the cost of maintaining integration if they need a specialised program to support interoperability. Limited value for non-clinical services, those staff that can't access the records, and being situated in a broader health system that isn't holistic yet. So we need more work to create a more holistic health system as to support these digital integration. Next slide, thanks. So we've also done a survey in partnership with Lived Experience Australia, looking at perspectives of people in the community, particularly in the mental health sector, of using My Health Record. So this survey had about 650 people with lived experience of mental health challenges. I'm using that term rather than consumers responding, and about 240 people who identify as carers of someone with lived experience. I'm using the term mental health carers here. So you can see that most, over 80%, said that they have a My Health Record. About 40% said that they're actively using it. And promisingly, the majority, 70 to 80%, were aware that they can nominate a representative, often a family member, to help manage the record, and that they can control which health professionals can access what information in that record. Also, around half said that they would be willing to upload a mental health advance directive to My Health Record if they made one. So benefits that people most identified with about my health record were, again, the convenience while traveling, that health professionals can still access their information, not having to remember or use paper copies, and being able to keep all your health information in one place. That control of being able to see what information on your record is really important to people, and fewer delays in accessing treatment because health professionals have all that information at the same spot. The concerns that people often talked about were, again, security of information in my health record, incompleteness of the records, that is not as useful if not all the information is there, misinformation where a health provider might have entered data or put information in a record that a client disagrees with, and you can't provide context around that to other health professionals, and stigma and discrimination that unfortunately people are saying, I don't want to have my diagnosis of mental illness in my record because then health professionals will treat me differently and other concerns won't be taken as seriously, which we know happens. Next slide, thanks, Hannah. So these quotes on the left re-illustrate those points that people have raised about the positives and negatives of my health record. And really, that point in pink of people are saying it's been empowering to me to have this record and important to me and my family of chronic health issues. But my negative experiences have been with healthcare providers and hospital services still need reminding to upload and access the information. When we asked people overall, what was your experience with my health record? 45% said was positive, 40% were neutral, and 16% negative. And about half of people said that they wanted more support to understand how my health record works. So overall, our conclusion is that while there is a cohort with significant concerns about security and stigma, overall, most people are willing to use my health record and see the benefits of it. But we still need changes to support better system integration and how healthcare is delivered so that we can make the most of it, and that's so that providers are using it consistently and fully. So that's just a little overview from Mental Health Australia. And I'm going to pass now to Guy Edwards from CoHealth to give us a little bit of a background from their perspective as a service provider. Unfortunately, and this speaks to interoperability, Guy can't use Zoom on their laptop today, so he's just going to give us a little verbal presentation. Thanks, Guy.
Thank you very much, Ingrid, and my apologies to everyone for my technical difficulties today. So just for a little bit of background on who CoHealth is and what we do, we are a community health organisation in Victoria. We operate predominantly in Melbourne's northern and western suburbs. And that means that we serve really a catchment and a base of clients and communities who have had pretty significant experiences of disadvantage and disenfranchisement in health systems and services over time. A large number of our clients are from culturally and linguistically diverse communities. We have a specialist Aboriginal and Torres Strait Islander health team, and we work both due to our geographic spread and also because of the position that we take as a community health organisation. We work in a very focused way with communities that we feel are otherwise underserved by the health system and where we feel we can make the greatest impact to health outcomes for our communities. As a mental health service provider, CoHealth has a relatively long history of providing mental health services. I think what I wanted to focus on today was some of the new work that we're doing in the mental health system. So Victoria, as an outcome of the Royal Commission into Mental Health, has been implementing very significant system changes. And our part of that is as a delivery agency for a new form of local mental health service. So I'm very pleased to say we formally opened the Brimbank local mental health and wellbeing service yesterday. We've been in operation kind of in a soft launch for a few weeks before that. And this is really meant to be a new type of front door to the mental health service, a no wrong door approach where people can, adults over 26 can present and receive care without a referral from a primary care physician and can be offered care services from a multidisciplinary team. So in a sense, I think there's quite a lot of alignment between the vision that we have for transforming the mental health system and having accessible community level services and the broader vision of an interoperable, digitally enabled mental health system where people have access to consolidated information from multiple service providers to really improve engagement with clients. Where we want to be in the future, and I think this recognizes the reality that we face, like a lot of community health organizations, is I think we accept that I think we're unlikely to get to a single client management system over time. And that's because we have relatively complex funding constraints. Some of our funders require the use of particular client management systems. And because we have multiple funders, many of them have different and overlapping and sometimes contradictory requirements for reporting and performance outcome data and those sort of things. What that means is I think we need to take an approach where, from our perspective, a client record is always going to be distributed in some way across multiple systems. We've got a central system of record which holds our main client data, but we know that we're always going to need to be collecting data across multiple systems. I think for us over time, that's where we see platforms like My Health Record and tools like My Health Record really assisting us and clients in making sure that we are bringing together all of the information, not just that we hold, but that other providers hold as well. Today, we do have access to My Health Record, and it is available for our clinicians to use. It's available predominantly in a read-only mode, so we don't yet enable our clinicians to upload new information to My Health Record. But it is accessible and can be integrated into one of our core client management systems. I think where we still have some work to do and where we need to look at how do we better integrate My Health Record is not on the technology side, but more on the process side. When we look at how we engage with clients and how we start an episode of care and start a conversation, particularly in Brimbank Local, we start a conversation with the idea of how can we help. At the moment, we don't put My Health Record as a central part of those conversations. We're not asking people, do you have a My Health Record and how would you like to use it? We're really focusing on how we can help and how we can help people navigate the system. I think over time, that's where we need to look at how do we change and see more adoption of My Health Record. As Ingrid already mentioned, some of the constraints for us are likely to be around lived experience and peer workforce. We have a very strong focus as an organization on integrating peer workers into client journeys and really see peer and lived experience workers as a key both first point of contact and also in an ongoing relationship with our clients, where people are really forming a peer-to-peer recovery and an improvement-led relationship with a peer worker who's bringing their own experience to that therapeutic relationship. And in some ways, because that workforce is not AHPRA-regulated, there are going to be some constraints around access and engagement with My Health Record. So one of the things we will need to think about over time is how we're using multidisciplinary team structures to support those staff in still capturing information that needs to be included or reflected in a My Health Record as they engage with clients. Again, it's very much a sort of work in progress for us as we develop and build these systems. And I think one of the key constraints that we face is, in a word, the direct funding for these kind of activities. So like most health services, we're funded to predominantly to provide services to clients rather than funded directly to improve how those services work. That's something we have to, like everyone, do out of the surplus or notional surplus on top of that core funding. So that is, I think, a real strategic balance for us, and I think for many community organisations as they look at how they prioritise change in these areas. Noting that everyone's just listening to me talk with no slides or video, I might pause there and hand back to Ingrid, and I'm sure there can be some questions at the end of the session.
That's great. Thank you so much, Guy. And also thank you to Ingrid. It's fascinating hearing about the practical application of My Health Record in co-health and what some of the challenges have been, but also I think what some of the opportunities are going forward. So I'm now would like to welcome Marwa Usman, a digital health educator with the Australian Digital Health Agency team, to provide some more detail about how organisations and individual practitioners can engage with My Health Record. Over to you, Marwa.
Thank you. Can you just confirm that you can see my screen?
Yes.
Beautiful. Thank you so much. Thank you for the opportunity to be here to present to you all today. So today I'm going to talk a little bit about what the My Health Record is, the legislation around the use of the My Health Record, and of course some big considerations around security, because that's often an area we get asked a lot of questions about, particularly when we're talking about storing information about mental health and stigmas that can be associated with that, and making people feel comfortable to use the My Health Record as a platform for sharing their health information with the healthcare providers they choose to. So we'll finish off talking about some of the consumer access controls and then resources that are available via the Australian Digital Health Agency, and how you can get assistance for your organisation in getting connected to the My Health Record. And there will be an opportunity to take questions as well. So the My Health Record is essentially an online summary of a person's key health information. It's personally controlled, so a person can choose how often or how little they interact with the My Health Record. It's up to them which healthcare providers can access that record, and I'll talk a little bit more about what those controls look like. A person can choose if they want to nominate someone to help them manage their record, or if they prefer to do that on their own, and what control those people may have. The My Health Record is part of a national system, so it's available anywhere around Australia, 24 hours a day, 7 days a week, by healthcare providers who are authorised by their organisation to access the My Health Record system. And it's protected not only by the highest layers of cybersecurity, but also by legislation, so that any intentional misuse of information stored in the My Health Record system is severely punishable by law. So, how many Australians have a My Health Record? There are over 23.5 million total My Health Records, and this translates into at least 9 out of 10 people with a Medicare or DVA card having a My Health Record profile. What are the documents available in the record, and what are their sources of information? So I guess you can divide the information that you can find in a person's My Health Record from 3 main sources. The first is consumer information, so information that the consumer has uploaded to the record themselves. So things like the medicines they take, their allergy information, advanced care planning documents, and I'll talk a little bit more about these as we progress throughout the session today. And then there's also things that are uploaded by Services Australia, and these are the Medicare documents. So things like medicines supplied under the Pharmaceutical Benefits Scheme, or item numbers that have been claimed under the MBS, Australian Immunisation Register and the Australian Organ Donor Register information can be found there as well. And the third category is the provider documents. So this is information that's uploaded by healthcare providers and healthcare provider organisations. So it can be things like discharge summaries from hospitals, a shared health summary from a person's GP or a practice nurse at the clinic, for example, a dispense record from a pharmacy, or a prescription record from a prescriber. And the list goes on. You can even see pathology results, specialist letters. So there's a huge wealth of provider documents that can be found in the My Health Record. And I'll show you some examples of these as we progress and how they may be relevant in community health organisations. Now, the image at the centre of the screen shows you the My Health Record system generated overview documents. These documents are not uploaded by a specific healthcare provider. They're actually My Health Record system generated dynamic views that pull information from different locations within a person's My Health Record about a specific topic and condense it into a single view. So for example, the medicines information view can pull information, say over the last 2 years, for example, about the medicines that the person is taking according to their My Health Record, and condense it into a single view that's hyperlinked to the source documents that that information has come from. So you can simply follow the hyperlinks for further information about that episode of care. There's also a Medicare overview available, the immunisation consolidated view, which consolidates immunisation information, the pathology reports overview, and the diagnostic imaging reports overview. In terms of which healthcare providers are connected and contributing to the My Health Record, the bulk of general practices and pharmacies are connected. You'll see significant numbers on the screen there with over 99% of them connected to the My Health Record. And this is significant because there are automatic uploads that happen in the background from pharmacies and from general practice, particularly prescription and dispense records. Once the system is correctly configured, these uploads should happen automatically, and the healthcare provider only needs to intervene with that process when they wish to withhold an upload from the My Health Record because a patient has requested that something not be uploaded, for example. Now, you'll also see the numbers for public hospitals quite significantly high. We've got over 95% of public hospitals using the My Health Record. And again, the upload of discharge summaries from public hospitals, once the system is configured, happens automatically. The clinician only needs to intervene in that process if they wish to withhold an upload to the My Health Record. Now, you'll see the number for specialists is significantly lower than the others. The reason being is that there's lots of work currently happening in this specialist space, as there is been a software industry offer by the Australian Digital Health Agency for software providers that cater for specialists to enhance their software and make it conformant for the use of My Health Record, which basically means that by enhancing their software products, the specialist would be able to access the My Health Record directly from within their clinical software. They're not having to log into a separate system, which makes them more likely to utilize the My Health Record. And they can also share information about their patient to the My Health Record by uploading the specialist letter. So this is great opportunity for sharing of information amongst the healthcare team, because previously only the referring healthcare provider would have direct access to that specialist letter, but now the entire healthcare team that is connected to the My Health Record can actually log on and view that specialist letter. So we're expecting the number of specialists connected and using the My Health Record to continue to increase as we do more work in this space. There's also lots of work happening in the aged care space and the allied health space currently to get more and more aged care facilities and allied health providers on board as well. So this shows you how people are currently using the My Health Record from a consumer perspective. We have seen a sharp increase in the use of My Health Record because of the COVID pandemic, particularly for viewing pathology and diagnostic, more so pathology than diagnostic imaging, because we have a lot more pathology providers uploading to the My Health Record in comparison to diagnostic imaging. And so seeing test results and things of that nature, particularly for COVID-19 results that are available immediately in the My Health Record once the results are available, whereas for certain other tests, there may be that 7-day moratorium where the consumer is not able to see their result until 7 days have passed to allow their healthcare provider to initiate any recalls and discuss the results with them if necessary. So how do healthcare providers engage with the My Health Record system? There are two ways that healthcare providers and their organisations can access information stored in the My Health Record, and that's essentially either through a conformant clinical software, and if you'd like to know which softwares are conformant to allow you to access the My Health Record, you can check the Register of Conformity on the Australian Digital Health Agency's website. There is a link on the screen, and you will receive a copy of these slides following the session. Or alternatively, if you are in an organisation that is not using a conformance software, meaning that you cannot access the My Health record directly through the clinical information system that you are using, then you are able to access the My Health record through the National Provider Portal. Having said that, the National Provider Portal is a viewing platform only, so you wouldn't be able to upload any information about your patient to the My Health record. You'd only be able to view that information. And because it is a separate platform, it is a separate login, and having to enter the patient details into that system to look up their details to be able to assist them further and find out more information about them. So we do know that when the My Health record is accessed through conformance software, it fits more smoothly into workflow, and we're more likely to get that meaningful use and engagement with the My Health record system, because it doesn't slow the clinician down in their natural workflow. Now, the other way that you can gain access to information stored in a patient's My Health record, if you are in an organisation that is not connected to the My Health record at this point in time, or they're not, that may be because they're waiting to get conformance software, whatever the reason may be. There is a new My Health app, which allows a patient to conveniently access information stored in their My Health record securely via this app. And they can also share this information with healthcare providers that they wish to share that with. So I'm going to play a quick video that demonstrates some of the functionality available within this app. And I guess this is something that you can promote with your clients so that it can be a source for you to obtain their health information if you're unable to access their My Health record. So give me a tick, I'll just play that video.
Your patients will now be able to access information in their My Health record through the new My Health app. This means that patients like Tabitha, who has several medical conditions and has trouble remembering her medical history in detail, will have secure and easy access to their health information on their mobile device. This will be particularly useful for you as an allied health professional if you are not yet connected to My Health record. For example, Tabitha can show and share information from her My Health record with you, such as medicines information, diagnostic imaging reports, and discharge summaries. It's secure, convenient, and easy to use, and allows patients like Tabitha to access and share their key health information anywhere, anytime.
So that, I guess, gives you some idea of the functionality available within that app, and that it can allow you, I guess, more quick access to information without having to spend time in the administrative backend chasing and waiting for faxes if something can be easily retrieved from the patient themselves efficiently. So here I've got an example of what a shared health summary looks like that can be uploaded to a person's My Health record by their main healthcare provider. Most often that's their GP, but essentially it has to be either a doctor, a registered nurse, or an Aboriginal and Torres Strait Islander health worker with a certificate for. The shared health summary is designed to capture 4 key areas: allergies and adverse reactions, medications that the person is taking at the point this document was created, their medical history, and immunisations they've received. And at the bottom, there's the administrative details section that shows you who the healthcare provider was that created this document and the organisation they come from, so that you can be aware of who they are and reach out to them if you need any further information. And the idea with this is that once there's a significant change to a person's health status, that their GP would update and reflect this in the My Health record by uploading a new shared health summary that should supersede the previous one. Now, that a GP creating this document doesn't actually need to sit there and write all of these things through. When they're using a conformance software, it actually pre-populates this document by pulling the information from the information that's stored locally in the system about this patient. So it's a very efficient process designed to be easily completed at the conclusion of a typical consultation with their regular patient. Now, this is the medicines information view in the My Health Record. And if you recall, this is one of the dynamic views that I mentioned that is created by the My Health Record system by pulling information about medicines from documents that have been uploaded to the My Health Record, whether it's from a shared health summary, from the GP, or a discharge summary from hospital. Here, what you've got on the screen is the medicines preview tile highlighted, showing you what the medicines are that this person is taking according to their My Health Record. Now, remember, the My Health Record is not designed to replace other sources of information. It's designed to be a complementary or an additional source of information. You would seek to compare that with other sources like the patient or their carer, for example, because there may be reasons why things may not appear in their My Health Record. So if the person has requested for something not to be uploaded to their My Health Record, for example, for whatever reason that may be, or if the person has been to a pharmacy that, a locum pharmacist is there that day, and so their unique healthcare provider identifier for that pharmacist is not input into the system correctly, and therefore that connection with the My Health Record doesn't happen, and so the record of the dispense is not uploaded to the My Health Record. There may be reasons why things may not appear in a person's My Health Record. There's also a link to the most recent shared health summary, and if the person has been to hospital recently and discharged, a link to the most recent discharge summary can be accessed through that medicines view as well. Now, the Medicare overview shows you some important information as well. Prescriptions supplied under the pharmaceutical benefits scheme or the REPAP benefits scheme will appear here as well. And this can be useful if, as I mentioned, a person has been to a pharmacy that's, the system's not correctly configured because, the pharmacist is a locum and they haven't input their unique healthcare provider identifier individual into the system. And therefore, that upload of that dispense record is not uploaded to the pharmacy. You may find that if you compare the information from, the prescriptions and prescriptions dispensed in the PBS information through the Medicare overview reflects a medicine that is not listed in the as items prescribed or dispensed to that patient, and that may be because that information has been uploaded through Services Australia because it's been supplied under the PBS, so sort of giving you a clue as to something else that the patient may be taking there as well. Now, next is the Australian Immunisation Register and Australian Organ Donor Register information. And the section at the bottom, which I've expanded here on the right-hand side, is the MBS and DVA items claimed. Now, you can actually access the Medicare overview as a complete overview or for the last 12 months only. And this can be particularly useful if you're trying to establish, who is involved in a person's care, if you're trying to, do any of those care coordination activities to try and establish which specialists are involved or which GP is involved or what other services may be implicated. Anything that has been billed through Medicare, the item numbers will be reflected here. And you can see a brief description, the service provider's details, as well as the date that item number was claimed. So it can serve as a starting point for you to begin to put the pieces of the puzzle together as to who was involved in this person's health or who may have previously been involved in a person's health. So if a person, mentions that they've seen a psychiatrist in the past when they were living in another area, and they tried a few medicines and there were some side effects that they had, but they can't recall, what the medicines were that they had these side effects to, and you can't recall the specialist's name, utilizing something like this may be a great starting point to help put the pieces of the puzzle together to decrease that administrative burden of finding the health information. This is an example of what an event summary looks like, and an event summary can be uploaded by any healthcare provider. It doesn't need to be a doctor, so any healthcare provider that is using a conformance software to access the My Health Record system is able to upload an event summary to reflect information in a person's My Health Record. The My Health Record, as I mentioned, can also be utilised to access discharge summaries from hospitals. So it saves significant time, calling and waiting for documents to be sent over or faxed across. and also serves as a great platform to store advanced care plans and goals of care documents. Now, advanced healthcare directives are very useful documents because they essentially allow you to create a document that tells people how you want to be treated when you become unwell. And this is particularly relevant in the context of mental health, making those decisions when you are when a person is able to make them, making those decisions about their preference for what their treatment may look like or what the medicines that can be used are, allowing that platform to create and then save that document in a location where where your advanced care custodians can access it, or where the person nominates who those custodians are, who they're comfortable to carry out what they've indicated in that directive for their healthcare team to easily access. There are nuances though between the different states and territories in how these documents are created, the requirements around that, and they can vary from state to state. And we'll send on some information linking you to the different requirements in the different states and territories, and whether they're legally binding or not for the healthcare providers involved in carrying out that care. So I want to use a small scenario, I guess, to paint a picture of how the My Health Record can be beneficial to assist in the management of patients. So we've got James, who's 45 years old. He's got multiple chronic conditions that include bipolar disorder, diabetes, and chronic pain. There are lots of people involved in the healthcare teams, lots of organizations. So you've got the allied healthcare providers, that could be the community health service as well, whether seeing a podiatrist externally. There's the hospital that's also involved, and the clinicians there. There's the regular GP, as well as any specialists as well, whether it's the psychiatrist or the endocrinologist and so on. So there's already lots of people involved in that healthcare picture, and most often the documentation or the specialist letters would be going back to the GP, and other people involved in James's healthcare may not have access to that information. So the allied healthcare providers may not have access to the specialist letters or to the information from the community health service, or even to the information from hospital, so that discharge summary. Having access to something like the My Health Record means that all of these parties can log on to the My Health Record, even if they're not using conformance software, through the National Provider Portal, and be able to view the discharge summaries from hospital. They can be able to view the pathology results, looking at the management of diabetes, looking at the medicines that are being taken, giving them an idea of who James's regular pharmacy is, which can then narrow down who's involved in his care, giving a better picture of what compliance may look like by reaching out to that pharmacy. Even having a look at the medicines that James is taking can give us an idea of how complex the management of his mental health is, whether there's likely to be psychiatrist involvement, or whether it's the prescribing is appearing to be from the GP only. Any recent hospitalizations and discharge that are of relevance to the current acute presentation being treated, and so on. So already it allows that information sharing, and by allowing that information sharing, there's decreased time that's spent by administrative staff sending and receiving or waiting for information to be received, either to hospital or from hospital, or to the GP and from the GP, because that information can be accessed through the platform. So finally, I want to talk a little bit about when you can access the My Health Record. So if you are providing care for a patient, so long as you are providing care for them, even if they're not directly in front of you, you are able to access their My Health Record and upload information to it. If you are uploading information that may be particularly sensitive, you can mention that to them that you are using the My Health record and you'd like to upload something. If they indicate that they don't want something to be uploaded, you do need to respect their wishes. You can certainly engage in a conversation with them about why you think it's a good idea and explain that they can use access controls to limit who can see this information. But ultimately, you do need to respect their wishes. Now, I want to touch on a little bit about who can access the My Health record. I mentioned that all healthcare providers can, if they're accessing the My Health record from an organisation that has registered with the Healthcare Identifier Service, they can access the My Health record. They need a unique identifier called a Healthcare Provider Identifier Individual, or HPII, and this is unique to each individual healthcare provider. It is linked to their APRA registration number, which is the primary registration board for healthcare providers. There are some professions that are not APRA regulated. They have their own boards for regulation. So for those healthcare providers, they need to, they can still access the My Health record, but they first need to apply for a healthcare provider identifier individual. And this can be done online. So you can apply to get a HPII, and then you will be able to utilize that to get connected to the My Health record system. Every time there is an interaction with the My Health record, the unique identifier for the healthcare provider involved is recorded, so the HPII of the specific healthcare provider, as well as the HPIO of the specific organisation, so the Healthcare Provider Identifier Organisation number, which is unique to each organisation, as well as the unique identifier for the individual who is receiving the healthcare service. Now, the IHI, or the individual healthcare identifier for the patient receiving the service, is linked to their Medicare or DVA card. So every time there is that interaction with the My Health record, you've got the recording of which organisation, which healthcare provider, and for which patient, and when. So all of that is recorded to ensure, these healthcare identifiers are in place to ensure that we're always accessing the right record, recording the right information for the right patient. There are legislations in place, a strong legislative framework that sets controls and the supports for who can access and use the system and how that use has to take place. These are the instruments displayed. There are links for these, so you can utilize these slides to read about these in more detail. I guess if there's one key takeaway I'll leave with you in terms of the legislation, there are strong penalties for misuse of the My Health record system, with penalties reaching up to 5 years jail time and $333,000 in fines. Now, we do get asked a lot of questions about, is the My Health record secure? And of course, everything is stored securely in Australia. There's no information that goes offshore. There are lots of safeguards in place to protect the My Health record, and strong encryption, firewalls. The Australian Digital Health Agency, which is the system operator of the My Health record, has a cybersecurity centre that monitors the My Health record 24 hours a day, 7 days a week. And then on top of all of these requirements and the conformance requirements that are in place, so any system that wants to have that direct access to the My Health record from within must undergo a conformance process that is quite rigorous, and that's to preserve the integrity of the My Health record system. So in terms of consumer controls, because I did mention that the My Health record is controlled by each individual, a person can choose to nominate a person that they can choose, so whether it's a friend or a carer, to help them manage their My Health record with them or on their behalf. If they choose, they can also choose what level of access they have, whether it's viewing only or whether it's that they're able to make changes to their My Health record. And this is what's known as a nominated representative, so someone that you can invite to help you manage your My Health record. There is also what's known as an authorized representative, and an authorized representative is essentially a person who is responsible for managing the My Health record of someone who's not able to make decisions for themselves. So in the case of a parent of a child who's under the age of 14, they are automatically the authorized representative of that record. In the case of an elderly person, for example, who's no longer able to make their own decisions, a person can apply to become an authorised representative, but they would need to produce documentation that supports that application in order to be granted that level of control. In terms of who can access a person's My Health record, an individual can choose to restrict access to a specific document in their My Health record, or they can choose to restrict access to their entire record, so that if a healthcare provider were to attempt to access their My Health record, they would be prompted with a message to enter an access code before they can proceed, and they wouldn't be able to proceed any further without entering that access code, which would be expected to be provided by the individual or their carer during a consultation. Once they're given that access code, then that organisation can access that person's My Health record for the next 3 years, unless the person logs onto their My Health record and revokes that consent earlier, which they can do at any time by logging on through MyGov. Now, an individual can't edit documents that have been authored by healthcare providers, but they can choose to remove documents from their My Health record. They can also choose to receive an SMS or email notification of when a healthcare provider accesses their My Health record. And they can also choose to be notified if a healthcare provider organisation uses the emergency access functionality to bypass any access codes they have in place to access their My Health record. And there are specific rules around the use of this emergency access functionality. It is rigorously audited by the system operator. And there's also an audit log of all access to the My Health record. So an individual can actually log on to their My Health record at any time and view which organisations have accessed their My Health record and when. So there's significant transparency in that for an individual. So that brings people a lot of comfort in using the My Health record system. In saying that, less than 3 out of 1,000 people that have a My Health record have actually chosen to exercise any of these additional privacy settings. So in most cases, you won't see that you need to enter these access codes to access the My Health record. Now, I'm getting near the end, I promise, but I'll talk briefly about what your organisation can do if you're interested in getting connected to the My Health record. In order to get connected, your organisation needs to develop a My Health record security and access policy. There are lots of templates available through various organisations, including the Office of the Australian Information Commission, have a template policy that can be utilised and adjusted to suit the services offered in your organisation. This needs to be developed before your organisation registers with the HI service to access the My Health record. Sorry, when I say the HI service, that is the Healthcare Identifier service. Then you would need to train your staff to ensure that they're familiar with the policies and procedures in place in your organisation with when they can access the My Health record. And again, there's lots of resources available on the Australian Digital Health Agency's website. And there are ongoing participation obligations, so ensuring that your staff are up to date with what the requirements are and that they're using the My Health record in accordance with policies and procedures, and carrying out the necessary training to ensure the integrity of the system. Now, there are links on the screen for all of these in terms of resources. So all of those underlines are hyperlinks that will take you to further information. But you can also reach out to the Australian Digital Health Agency or your local primary health network, and they can assist you with that process of getting connected to the My Health record system. Now, the first step in that process of who needs to take that step to get the organisation connected to the My Health record, there are roles that need to be assigned. So the responsible officer of an organisation and the organisation maintenance officer or officers. So with the RO or responsible officer, there is only one of these, and it's usually the business owner or the CEO, and they are the ones that have to initiate that HPIO registration process for the organisation. Whereas the organisation maintenance officers, there can be more than one, and in fact we recommend that you have more than one of these at the organisation, and they're more responsible for the day-to-day administration and ensuring that the staff are using the My Health record in accordance with the policies and procedures of the organisation. So there's some great resources on our website about how to use and navigate the My Health record system. as well as how to get connected as well. These are our contact details if you'd like to reach out for further support. So with that, I will stop sharing and hand back and see if there's any questions that have come through that we can take.